Honorable Chief Guest, Chairman Higher Education Commission, Professor Dr. Prof, distinguished guests, ladies and gentlemen, Assalamu alaikum. Thank you very much for giving me the opportunity to share the stage with the dignitaries today. Being Rector of Superior University, it is my absolute honor to welcome all of you in International Medical Conference, which is jointly co-hosted by University of Lahore and Superior University. So I'm very thankful for the entire organizing team for putting a wonderful conference today. So before I jump onto the topic today, so I would like to tell you a bit about Superior University. Superior University is a university driven by its vision, mission, and values. Our focus on student success is actually helping us to design or bring innovation into our educational models and guiding us to design some creative solutions to tackle the challenge of student employability at Superior University. So our very innovative and experiential learning framework, which is 3U1M. 3U1M is 3 years in the university, powered by project-based learning and 1 market-intensive year, followed by 4 career streams. It has the power to actually not only prepare the market-ready graduates, but also to nurture the next generation of entrepreneurs. It's been 4 years since we implemented our 3U1M program to transform our entire undergrad education at Superior University. I feel so proud in sharing that 140 student-owned startups are commercial. They have created 1,500 new jobs, and they have generated 13 billion revenue. And moreover, our student employability has significantly improved from 70% to 90%. And this is all just because we are measuring the socio-economic impact of our 3U1M program. But being Rector of Superior University, I'm mindful of the fact that Superior University should be known by its research. So we envision to promote applied research at Superior University, that research that have a societal benefit. And our 5-year strategic plan, which is SOAR to Roar, has very promising initiative to make Superior University one of the leading research university by 2028, inshallah. And this conference, I must say, it is one of the strategic initiative of just promoting research culture in Pakistan and to provide a platform where researchers can connect and share their knowledge. As you all know that AI has transformed or revolutionized almost every field, and the role of AI in medical is well established, especially in terms of diagnostics, treatment, planning, and patient management. So AI-driven innovations has a power to actually analyze medical imaging, and they can actually help in assist in detection and classification of diseases, and they help us in measuring the impact of maybe treatments on patient outcomes with better accuracy and reliability and efficiency. So I was just going through this policy document, which is co-jointly developed by the team of Superior University and team of University of Lahore. And I got so excited to see that there are so many promising opportunities AI can offer as far as the medical and dental education is concerned. For example, AI tutors, AI chatbots, and AI-assisted simulations, and most of all, like AI algorithms to actually analyze the large medical data sets to actually design informed curriculum for medical and dental. So I believe there is a huge potential in embracing these kind of technologies in healthcare to improve the delivery and the quality of healthcare in Pakistan generally. So considering the promising role of AI, I must suggest that there should be increase of investment, especially the government investment, if we really want to bring improvement in healthcare in Pakistan, and not only in Pakistan but to compete globally. And there has to be like dedicated capacity building programs for faculty and for practitioners to embrace the disruptive technologies AI is offering. And we must able to promote interdisciplinary research in order to foster the indigenous innovations in healthcare, especially in Pakistan. And I must suggest that we should be able to integrate artificial intelligence in telemedicine and remote patient monitoring in order to improve the quality of like healthcare and the access of healthcare to different people, especially in rural areas. But for that, I strongly suggest that there has to be community engagement and awareness for the cultural sensitivity. Otherwise, we won't be able to actually indulge into these kind of technologies. Although it has a promising future, and with the introduction of AI in healthcare, it has transformed the entire health sector. But I feel like adoption of AI needs careful ethical considerations and a proper regulatory framework that can actually guide for the development, implementation, monitoring, and evaluation for better outcomes. In the end, definitely, I would like to appreciate the role of PAMI in promoting the culture of collaboration, and this conference is a wonderful example of collaboration between different stakeholders. So I really want to thank the president of PAMI, Professor Dr. Chaudhry Abdur Rehman, for just creating this wonderful platform where we can connect with each other. And also, I'm very thankful to PAMI for recognizing the true heroes of the society by organizing Healthcare Excellence Awards last night. So it's a huge recognition for the entire medical fraternity. And I'm also very thankful, and I want to appreciate the hard work and dedication of the brilliant teams of University of Lahore and Superior University. They have brilliantly organized this conference, so I must appreciate their hard work. And I also want to wish all the participants good luck. And I'm sure you're going to get maximum out of this conference. So thank you very much. Enjoy your day.